Diuretics. Diuretics are medications that are often used in the therapy of kidney and cardiovascular disorders, such as hypertension, heart failure, and others that are manifested by edema. The goal is to help increase urine flow and reverse abnormal fluid retention by the body. To understand how diuretics work, we need to take a look at the kidney's functional unit, the nephron. The outer layer of the nephron is the cortex and the inner layer is the medulla. Oxygenated blood passes through the afferent and efferent arteriole. The arterioles form the glomerulus, which is encapsulated by the Bowman's capsule. Together, they form the renal corpuscle that filters the blood to form filtrate. From the renal corpuscle, the filtrate travels to the proximal convoluted tubule or PCT while reabsorbing sodium and water. From the PCT, the filtrate travels down the loop of Henle and back up through the ascending limb. Water and sodium are further reabsorbed here. Filtrate concentrations happen in the collecting duct. Final reabsorption and excretion of ions and molecules happen here to form urine.
Carbonic anhydrase inhibitors. Carbonic anhydrase is an enzyme that affects acid-base balance by its ability to form carbonic acid from water and CO2. Generic acetazolamide, brand Diamox, therapeutic, diuretics, pharmacologic, carbonic anhydrase inhibitor. This drug is absorbed in different amounts, but dosage affects absorption. Distribution is generous and even enters the brain and crosses the placenta and breast milk. It is urinated mostly unchanged by binding to proteins in your blood. By mouth, this drug can take at least an hour to take effect, which is strongest for 2 to 4 hours and can last 8 to 12 hours. Acetazolamide decreases excess pressure in your eyes, causes urination of water and electrolytes in the kidneys, decreases harmful hyperactivity of your nerves, works against the toxic effects of high-altitude climates, and prevents kidney stones. Reasons for use in this patient's case: edema due to heart failure. Max dose is by mouth 250 to 375 milligrams a day. Common side effects include electrolyte imbalances, fatigue, nausea, vomiting, and dizziness. More serious side effects are dehydration, blood dyscrasias, and flaccid paralysis. Monitor signs of hypokalemia, visual acuity, put on standard seizure precautions, monitor eyes and nose and daily weights, administer with food and potassium supplements, and encourage fluids to prevent stones. Be sure to monitor serum electrolytes and complete blood counts. Report numbness, tingling in extremities, weakness, rash, sore throat, unusual bleeding or bruising, fever, or any allergic reaction. Use sunscreen and protective clothing. Advise glaucoma patients to follow up with eye exams. Now we have our loop diuretics. They are the most effective diuretics. They act by blocking resorption of sodium and chloride in the loop of Henle. When given IV, they have the ability to cause large amounts of fluid to be excreted by the kidney in a very short time. Loop diuretics are used to reduce edema associated with heart failure, hepatic cirrhosis, or chronic renal failure. Furosemide and torsemide are also approved for hypertension. Generic prototype: furosemide, brand Lasix, therapeutic class, drug for heart failure and hypertension, pharmacologic class, diuretic. Loop diuretics work in the loop of Henle and prevent reabsorption of sodium and chloride so they get excreted in the urine. About 60% absorbed after oral administration, also from IM sites. Crosses placenta, enters breast milk, minimally metabolized by liver, some non-hepatic metabolism, some renal excretion as unchanged drug. Half-life is decreased in renal impairment. Easier for patient understanding, this drug enters your blood through various routes, is broken down by your liver and exits your body in your urine. Oral effects are the slowest, IV effects are the quickest. Effects can last up to 8 hours by mouth and muscle, but only 2 hours by IV. These durations are important when considering dosage, so please adhere to your prescription. 20 to 80 milligrams loading dose. Max dosage is between 80 milligrams and 320 milligrams a day. Common side effects include hypokalemia, post-urinary hypotension, tinnitus, nausea, diarrhea, dizziness, and fatigue. Major effects are severe hypokalemia, blood dyscrasias, dehydration, ototoxicity, electrolyte imbalances, circulatory collapse. assess fluid status, blood pressure and pulse, assess fall risks, assess patients receiving injections for severe hypokalemia and toxicity, assess patients for tinnitus and hearing loss, assess for sulfa allergies. Ethacrynic acid is a non-sulfa drug. Admit no later than 5 p.m. to avoid nocturia and sleep disturbances. May be taken with food or milk to minimize gastric irritation. Tablets may be crushed if patient has dysphagia. Do not administer discolored solutions or tablets. Change positions slowly to minimize orthostatic hypotension. Alcohol, exercise during hot weather, or standing for long periods during therapy may enhance orthostatic hypotension. Consult provider regarding high potassium diet. Report weight gain more than 3 pounds in a day. Contact provider ASAP if rash, muscle weakness, cramps, nausea, dizziness, numbness, or tingling of extremities occurs. Advise diabetic patients to monitor glucose closely. May cause increased blood glucose levels.
Osmotic diuretics. It's used to maintain urine flow in patients with AKI or prolonged surgery. It's a high-potent diuretic only given by IV route. They're rarely used because of potential toxicity and can worsen edema. The generic name is mannitol and the brand name is osmotrol and resectisol. 100% of the medication gets absorbed into the body through IV. The medication will start to work in 30 to 60 minutes, be most effective in an hour, and its effect will last for 6 to 8 hours. Osmotic diuretics work in the PCT and nephron loop by using osmosis, where water flows from a lower to higher area of concentration. It acts as a solute and prevents water from being reabsorbed and increases the excretion of nearly all the electrolytes. The reason for use in this patient's case is to increase renal blood flow, which was affected by acute renal failure. The safe dosage range is 50 to 100 grams as a 5 to 25% solution. These are the common and serious side effects for mannitol. Some nursing implications and patient education would be to monitor and report abnormal vital signs, eyes and nose, renal function, and electrolyte levels. Assess for the symptoms of dehydration, electrolyte imbalance, and worsened edema, and educate patients to report significant weight gain and signs of electrolyte imbalance. Potassium-sparing diuretics increase urination without losing potassium. It's used in combination with the other diuretics to decrease potassium loss, and it produces a weak diuresis. The generic name is spironolactone and the brand name is aldosterone. Potassium-sparing diuretics work in the DCT and the collecting ducts by inhibiting the hormone aldosterone, which is produced in the adrenal cortex. This will prevent sodium reabsorption, which will decrease water retention. The medication is more than 90% absorbed and converted by the liver to its active form called candrenone. The medication will start to work in 2 to 4 hours, be most effective in 6 to 8 hours, and last for at least 2 to 3 days. The reason for use is mild hypertension and slow progression of heart failure. The safe dosage range is a max of 400 milligrams per day. Common side effects are headache and fatigue. Serious side effects are dysrhythmias, hyperkalemia, dehydration, hyponatremia, and other blood dyscrasias. Nursing implications include monitoring eyes and nose and lab values, assessing for electrolyte imbalances, and skin rash, which may be life-threatening. Check blood pressure before giving with another antihypertensive drug, and administer in the morning with food or milk to minimize GI irritation. Educate the patient to avoid salt substitutes, foods high in potassium, and activities where you have to be alert. Tell the patient to immediately report rash, muscle weakness, or cramping, and any severe symptoms.
Thiazide diuretics. Thiazides are the largest and most frequently prescribed diuretics, primarily used for hypertension and to relieve edema from heart and liver failure. Less effective than loop and is ineffective for patients with AKI. For the prototype, its generic is hydrochlorothiazide and the brand is Microzide. Hydrochlorothiazide is the most widely prescribed diuretic for hypertension, producing a 10 to 20 mmHg reduction in the patient's blood pressure. It is indicated for ascites, edema, heart failure, HTN, and nephrotic syndrome. Thiazides work in the distal convoluted tubule, where it decreases the reabsorption of sodium. More sodium is excreted in the urine, and water follows sodium, so diuresis is increased. Hydrochlorothiazide has rapid absorption and gets distributed into the extracellular space. It will be excreted unchanged by the kidneys. When taken by mouth, it starts to work in 2 hours, and it peaks at 3 to 6, and it lasts in the body by about 6 to 12 hours. The reason for use in this patient's case is due to peripheral edema on both lower extremities, shortness of breath, and the diagnosis of heart failure. The maximum dosage is 200 milligrams per day. Hydrochlorothiazide has major side effects that is similar to the other diuretics, such as Stevens-Johnson syndrome, blood dyscrasias, pancreatitis, and photosensitivity. The most common side effect is hypokalemia. Nursing implications include administering early to prevent nocturia, monitoring for signs and symptoms of electrolyte imbalances, digitoxicity because of concurrent use with digitalis glycosides, and assessing for rash due to SJS. Patient education includes proper monitoring of daily weights, avoiding sudden position change, avoiding alcohol and hawthorn due to additive hypotensive effect, wear sunscreen, and reporting rash right away and any other severe symptoms.